Hey guys, my name is Casey Mengel and I'm going to be discussing deaf and hard of hearing. So we'll start out with a little bit of a definition, and the Canadian Association of the Deaf kind of places deafness on a spectrum. So they'll define it as the extent of loss of functional hearing and also by dependence upon visual communication. So visual communication is just kind of referring to sign language as well as body language. Okay, next we'll go through some causes. Since there are varying degrees of deafness, there isn't one definitive cause. So what I have here are three very broad types of hearing loss, then we'll kind of go through the causes for each of those. So the first one is conductive hearing loss. This is usually structural, so you're probably going to be born with it, and it has to do with any issues with the ear canal, the eardrum, or the bones of the middle ear. The second type is sensory neural hearing loss. This can happen due to hearing really loud noises, or you could be born with it, and it's nerve related, so it's going to have to do with the auditory nerve. And the third one is mixed hearing loss. So this is going to be a combination of any type of damage to the middle and or outer ear with damage to the inner ear or auditory nerve as well. Okay, next we'll go through some symptoms. I grouped them with children and adults just because they do kind of vary a little bit. So the main symptoms in hearing loss in children are not responding to noises, responding slowly, and having issues with learning to speak. They can also have deficits in motor skills, coordination, balance, and walking or crawling is that last bullet point there. And this is just due to the vestibular apparatus being in the inner ear. So if there's any disruption or issues with the inner ear, then it is going to be challenging for children to have the coordination to walk and balance. Okay, as for adults, their symptoms are a little different, and this will have to do with progressive hearing loss. So this is going to be hearing loss that people aren't born with. They're mostly going to have signs that deal with conversations. So their symptoms would be difficulty following along in conversations, especially when it's more than two people. Having to turn the TV up louder than usual, feeling stressed or exhausted from having to concentrate on reading people's lips, ringing in the ears, and also requiring people to repeat themselves frequently. I had to move my little video to the side so you guys can read what I have on the slide here. But next we're going to talk about some risk factors. The first one being family history. So you're more likely to experience deafness or hearing loss if you do have a family history of it, especially if it has to do with deformities of the inner ear. Another risk factor are physical deformities of the head, prematurity, ototoxic medications taken by the mother during pregnancy. So these medications can be aspirin or other painkillers, but they would have to be taken in abnormally large doses. It can also include chemo, anti-inflammatories, diuretics, and some antibiotics. Other risk factors are aging, exposure to loud sound, smoking, frequent ear infections, and diabetes. Diabetes is newly researched in connection with hearing loss, but they are thinking that high blood glucose levels can damage blood vessels. So if someone has diabetes and it's not controlled well, then they can experience some hearing loss. Okay, moving on to some treatments. There are a few different treatments that people that have hearing loss can use, and the first one is a hearing aid. So this can be internal or external. External just be a regular piece like you see in the picture here. Goes right behind the ear. Internal would be an implant, so something like cochlear implant, where they actually do go in surgically and place a device inside the head, and then they also would wear a magnet on the outside of the head. The second one is corticosteroids, and these are kind of rare. They treat the autoimmune ear disease. And the last one is surgery, so this is going to repair any structural issues in the ear. Sorry, I had to move my video again just because it keeps getting in the way. The next one that we're going to talk about is anxiety and deafness. So people that are deaf do experience a lot of anxiety usually. So I just took this out of a journal, and basically this study took a sample of people with different degrees of deafness, and they gave them inventories that would rate their level of anxiety in different areas. So looking at the graph down at the bottom are the different categories of anxiety, and up along the side here are the percentages of people that do experience those anxieties. So looking at the severe category, I just pulled these numbers because this is probably going to be the people who have complete deafness, and 0% reported having any type of panic anxiety, 20% reported with generalized anxiety, 20% with separation anxiety, 23% with social anxiety, and 20% for school avoidance anxiety. So most of the anxiety is social, and it just stems from having that stress about not following along in conversations well and having to ask people to repeat themselves. It usually creates a decent amount of anxiety. Okay, moving on to deafness and exercise. So there aren't any strict contraindications for exercising with deaf people. So these are just some precautions to think about. It's usually good for a deaf person to be working out with a buddy. That way they're more comfortable and can communicate personally without having to worry about communicating with other people in the gym if they needed help or something like that. The second idea is to get a personal trainer. So this is kind of the same thing as working out with a buddy, except the person is certified in exercise, can help them out. Another option would be going to a workout class. So this is actually good for people who do have social anxiety and would avoid going to the gym just because of the interaction aspect of it. This can improve their social skills and give them confidence as well as keeping their health and fitness up. Basically, the idea for exercising with a deaf person is just making sure they're comfortable in the environment that they choose to work out in. Okay. As for the case study, we have a 55-year-old female. She was born totally deaf. Her blood pressure is 122/82, so that's good. Her BMI is 25.3, which is technically overweight, but it's not that bad. Her LDL is good. Her HDL is good. Fasting glucose is good, so she's not diabetic. She's a non-smoker. She did have a deaf mother, and her mother was diabetic, and she is sedentary. She's not on any medications as well. Sorry. Her goals are to become more active and increase her overall body strength. She wants to improve in balance and coordination and also become more comfortable with working out in public places. So for our client, I would choose 3 tests, one to test her strength, one to test her endurance, and one to test her balance. So we can get kind of baseline values for that so we can measure progress. I would do 1 rep max testing. I would do 1 upper body and 1 lower body. So it'd probably be something like the bench press and the squat. As for endurance, we would do a bike ergometer test. And for balance, we would do the Romberg test. Okay, so for the FIT principle, I broke it up into resistance training, cardiovascular training, and balance and coordination. So for resistance training, I think we would have her do 30 to 40 minutes of moderate intensity, 2 to 3 times per week. For cardiovascular training, I'm thinking 1 to 2 times per week, for about 25 to 30 minutes and maybe a moderate to high intensity to whatever she can tolerate. And balance and coordination 3 to 5 times per week for about 10 to 20 minutes. So this is just a sample resistance training program that I created for her. Since we are focusing on improving strength, we would do 3 to 4 sets of 5 of each exercise. So that's about 70 to 70% of her max weight. And we would do about 3 minutes rest in between each set. So to save time, since it is a long rest period, I think that it would be beneficial to do supersets. So we would pair back squat and bench press, deadlift and chest flies, sissy squat with the bent over rows, and so on, just so that we are more time efficient and she's not spending so much time in the gym. Okay, as for cardio, I would just have her pick one of these options per cardio day. So she could do a 15 to 20-minute run, um, 20 to 30-minute bike ride. Some interval training might be good if she can tolerate it. And if she is feeling tired the day, she can just do like a 30-minute walk. For her balance and coordination program, she could do 2 times each for 3 of these exercises that I have listed here. So she could do stork balance with tandem walk as well as a single leg ball toss with a partner. Or she could do recreational sports. So these will enhance her coordination as well as her balance and athleticism. So anything like soccer, tennis, or basketball would help out with that. So this balance and coordination program would be really important for her to do often, just to kind of train herself and get used to regaining that balance and everything just because of the vestibular system being messed up. It would be beneficial for her to regain balance and coordination so she can continue doing her ADLs as she gets older. So as for any additional information that you would want to gain on deafness and anxiety and exercise, these are 2 resources that I used. The first resource that I have listed is the study that was mentioned earlier in the presentation that had to do with anxiety and deafness. And the second one is a journal article that has to do with diabetes and deafness, kind of exploring the reasons why people that are diabetic do have hearing loss. So yeah, if you're looking for any additional information on deafness and hard of hearing with exercise or diabetes or anxiety or anything like that, definitely check those 2 links out.